Hi, my name is Shelley Sowers. I'm an instructor with UMA. I currently hold degrees in medical assisting, health service administration, nursing, psychology, as well as business. And today we are talking about the levels of need. So let's first begin by looking at our agenda. We will review the 5 levels of need, which are discuss a problem, we will discuss a predicament, discuss a crisis, discuss a panic, and then lastly, we will discuss what shock is. So let's start by all thinking back to a time. Could be something recent, could be something years ago. Maybe a situation where you felt ill or you felt as you needed medical attention in some sort of way, right? So let's kind of put ourselves into that position for a minute. And I want you to think, how did you feel in that moment? And how did you feel that you could be helped? Let's say if you were on your way to the emergency room or to the doctor's office, what was that expectation of help from the medical professionals at that time? And what was your need at that time? So let's just think about that for just a second, because I want you guys to really put yourself into the client situation, but also the view of how the healthcare professional could have helped in those moments. How did the levels of need begin? Paul Welter, in his book called How to Help a Friend, 1990, identified the helping relationship and those levels of need that we will talk about. To become an effective helper, which all of us will need to do, regardless of what area you are in the medical arena, it is necessary to recognize what level of need your client has in that particular moment. Although much of this book is established and it's geared towards helping friends, we can actually apply this to helping the clients that come into the office or to the hospital or whatever the case might be. So let's start off with talking about the level of need called problem. One thing we want to keep in mind about problem or a problem is that it does have a solution. And we think about problems in our life, not even really medical related, and every problem typically has a solution, right? And it might take us a little bit to get there, but has a solution. When you have a client that has a problem, they will have specific characteristics, such as, so if our patient has a problem, these are going to be the things we're going to look for. They may ask specific questions. They may want immediate advice. They may want immediate information about whatever their concerns or their problem might be. So how can we assist in using a helpful response? We would always supply the advice. So if they're looking for advice, we're going to supply that or put them in touch with someone who can supply that advice. And then supply information. There's a number of ways that we can supply information, right? We can supply it maybe via a printout that we have. We could give them web links to helpful resources. We could show diagrams or go over a video with them. Lots of different ways that we can inform and educate. So we're going to look for various ways because not everybody learns the same way. Now let's look at the next level of need, known as a predicament. A predicament is one in which there's no easy solution. It's not like with a problem where we know that there's a solution for it. There's no easy solution when a person is in a predicament or has a predicament. When you have a client that has the level of what we would consider a predicament, they're also going to have those specific characteristics, and they would be a feeling of maybe being trapped or not helped by advice given. So we're maybe giving advice, and we've given advice in the past, but they either didn't try it or it's not working. So they're in a predicament. We can assist using a helpful response, such as getting involved. If it's a predicament, it's probably going to be pretty involved. Let's get involved. Let's do what we can to help them through that situation. Works for openness. That's definitely going to be that level of relationship where our patient is able to open up with us, and therefore they're going to give us a lot more detailed information versus just something like a yes or a no response. Now let's look at the level of need called a crisis. And a crisis is a very large predicament, but it's usually short term. So that's the good thing. So we looked at problem, we looked at predicament, and now we're looking at crisis, which is a very large predicament. It's probably going to have a lot of moving parts to it, right? When you have a client that has, and they're in that level of crisis, they will have specific characteristics as well, such as they're going to express a sense of urgency. Urgency with resources, urgency with assistance. They may want help, but they could be afraid to ask. So we need to, of course, just kind of probe and sense, okay, are they asking for help, but not really? We have to be able to pick up on those nonverbal cues. We can assist by bringing the client back into the present, because when we are in something called a crisis, we might kind of almost lose control in a sense. We might start talking about stuff from years ago, stuff that really doesn't pertain to anything about the current predicament. So we want to bring them back into the present, back into the moment, essentially kind of back into reality to work on the current level of crisis. Accept the emotions that the client is giving, all right? And we have to make sure we don't take things personal, because during this time frame they may seem angry, but it's typically not with you. It's kind of displaced anger. It's coming from somewhere else. So work really hard not to take that personal. Always maintain professionalism. If you have a client that might be a little rude or says some things that maybe they shouldn't, we always have to maintain that level of professionalism. Now let's look at the level of need called a panic. So let's think about it for a minute. Do you think that you've been in any of the levels that we've talked about? So let's kind of recap. We've been through a problem. Most of us have had a problem at some point. We've been through predicaments. We've been through crisis. Now we're looking at panic. So kind of leading up to this point, do you feel like you've been through all of those different levels at some point in your life? The answer is probably yes. At some point you've been in that level. And then panic, of course, is the next on the level. This is a state of fear. One may see only one way out. And that's something I want you guys to remember. We're going to do some test your knowledge here in just a few minutes. And we're going to see something about panic. So they may see only one way out. You know, it's kind of like they're in a box and, you know, the only way out is to push up. It could be very difficult to talk them out of anything else other than this is my only way out. When you have a client that is within this level of panic, they will have specific characteristics such as do not listen. They may, you know, appear to be listening, but not really. Or they may interrupt you while you're talking and you're trying to give advice or trying to work through that situation with them. The mind is caught in a dreadful future event. So they may be thinking about and dreading what's coming because of this situation, or harping on something maybe that has already happened. It's very difficult to move the client out of this level, but it's something we have to work really hard to do. They may be completely non-rational, and that's something we need to expect with a person in panic. It's completely normal for them to feel in a sense that they're not able to rationalize with what you're saying, or you're not able to rationalize with them. So we can assist them by using touch. That kind of brings them back to reality. Using eye contact, that gives them a focal area and helps to bring them kind of back down to a lower level. Now let's look into the fifth response we will talk about tonight as far as the levels of need. Shock is a numbered or dazed condition. So we just talked about crisis, and we know that the crisis client might be non-rational. That can be bad enough, right? And kind of scary enough to assist with. But shock can be even worse. So be prepared for that as well. It's that dazed condition. When you have a client, they're going to have specific characteristics such as failing to act. You're giving them direction, but they're not responding. Their mind may relapse for a short period of time, and they might not have any memory of the relapse. You can assist them by acting for this person. So let's say that you are asking the patient to roll over and they're not responding, we might need to help them and assist them to roll over. It's especially if it's for their safety, that's something we'll need to do. We want to stay with this person until they are back to normal or to a normal state. So we don't want to just leave them, and that's something we have to remember with a lot of situations that come with healthcare. We can't leave a patient that is in need, specifically a level of need like we're looking at right now with shock. All right, we have gone through the 5 different levels of need. Now let's look at some test your knowledge questions. Let's kind of test your knowledge on what we covered on the different levels. Recognizing that clients have different levels of need helps professionals like all of us to focus their attention correctly. So if we can identify what level they're at, do you think that helps us focus our attention? What do you think? And we're going to pause here for just a minute. I'm going to let you guys think about that for a minute, and then we will look at the answer. Okay, so yes, being able to recognize what level the client is at definitely helps us with where to put our attention and where to put our best efforts, right? We don't want to put our efforts into a situation that we're not even dealing with. So we've got to know what we're dealing with first. So that is absolutely true. Okay, let's look at our test your knowledge question number 2. What level of need is this? John is a 55-year-old client. He is on the floor and appears to be dazed. I see some kind of keywords here we looked at earlier. He's not taking any action or direction that is being given to him, such as please lift up your arm. So I see a failure to act. The client appears to be dazed. So what level do you think that is? That would be shock. In that situation, they're not acting, so we're having to act for them. Let's look at test your knowledge question number 3. What level of need is this? Julie, a 22-year-old client, comes into the office today seeking advice or more information about a particular concern. So we can see the patient's coherent. They're coming in, they're asking for information, they're asking for advice. What do you think that is? Do you think that's a problem or a predicament? Problem or predicament? We'll think about that for just a second before we look at the answer. Okay, so let's look at the answer here. And this is going to be a problem, which is the very first level that we looked at. The client comes in, they're asking for assistance. They know that they have some sort of a problem. They're just trying to get more resources and information for that. Test your knowledge question number 4. And this is a scenario that we'll look at. Let's read through this and let's think about it as we're reading through it. Jackie, a 40-year-old client, comes in today to visit her psychologist for her weekly therapy session. She expresses concern with living at her parents' house, that she feels too restricted. Jackie states she just wants to get away and is going to pack her clothes, leave town. Although Jackie doesn't have any money for lodging, she doesn't have any money for gas. So not that Jackie can't leave, right? But there's not really a good plan in place to do that, a safe plan. Jackie further states this is the only way out, and the psychologist gives other suggestions. However, Jackie does not appear to be listening. So a couple of key things here. We see that Jackie is feeling like this is the only way out, and also it appears that Jackie's not listening. So those are kind of some key factors that go along with this particular level. So what do you think this level is? And if you can picture Jackie in this moment, feeling that this is her only way out, I'm just going to pack my stuff, I've just got to go. That's almost like a panic, right? So that level here is panic. Thank you very much for listening to the presentation, and I hope this was helpful.